So when is the vote?
Next week.
Specifically?
Well, I would expect that we'll turn to it perhaps as early as Tuesday and Wednesday. It's important we get this done and get it done soon. Next week is my expectation.
I think there's still a path. I'm not Pollyannish about this. It's very, very difficult when you can only lose 2 votes, and there may already be 2 that are irretrievable. We're in a tight spot, but we've got to give this every effort.
I don't think that we can fix this bill by doing a tweak here and a trim there. It needs a complete overhaul in order to garner my support.
Congressional sources are telling NBC News that Republicans are hoping to release a second draft of their health care legislation by Thursday. With us now from Capitol Hill, Republican Senator from Louisiana, Dr. and Senator Bill Cassidy. Doctor, Senator, very good to talk to you. Where are we sitting right now with this Republican health care bill?
I think you kind of had clips from the spectrum of opinion. We got to get it done, and it's all lined up to, oh my gosh, we can't do this particular bill. So it shows there's continued divide. Hopefully the new bill will bridge that divide. If not, there may be another solution yet.
What's that solution?
You know, I've always said, along with Susan Collins and others, that we should give the power back to the state. The idea that 700,000 people in Alaska almost as big as the lower 48, should have the same solution as Louisiana, New York, or California seems crazy. We should allow the state to come up with a solution for their state. And I continue to say that's a good Republican principle, good conservative 10th Amendment principle. That might be the way forward.
Mike Barnicle.
So, Senator, what are the odds that the United States Senate this week, or before you go into your August recess, that Mitch McConnell takes a knee on this bill, just a TKO, gets counted out, and that's it, and you move on to something else?
Mitch is not the kind of guy to take a knee. Now, granted, it might occur, but I would like to think, Mike, that there would still be that path forward, if not this bill, another. And I don't think any of us are ready to take a knee.
Mark Halperin?
Your conception, if you don't get your conception that basically the states get to decide, under the current Senate bill, who are the Americans who will be worse off?
I haven't seen the current Senate bill, so that's a little bit hard to say. But one of the ways to keep people from being worse off is by giving states large block grants, if you will, that they would wrap around those who might be negatively affected to keep them from being negatively affected. I would like to think that the people who would be worse off would be the special interest that kind of benefited under Obamacare. I'd like to think that we kind of take dollars back from them and distribute it to those who need it. But I've not seen the final bill yet.
But won't the poor be worse off if you're cutting $750 billion from Medicare and then in the underlying budget another $300 or $400 billion? Seems fairly obvious. You're a doctor, you know. You strip over $1 trillion from Medicaid funding. I said Medicare, excuse me, Medicaid funding. It's going to be people who are disproportionately poor and lower income who are going to be impacted by those cuts, right?
Two things about that. The way, if this bill works, the way it will work is that if you pull back on Medicaid, you actually create a private insurance option, which is as effective, as good for these folks as Medicaid expansion. Number one.
A private option will be as effective for the working poor?
Yeah, possibly. There are some people who do not take a better paying job because they do not want to lose their Medicaid. There's a cliff, if you will, between Medicaid benefits and that on private insurance. That should not occur.
Right, but there's single moms.
It should not occur that people.
But there's single moms that you know that don't know. But there's single moms that don't have a job, and you know that, and they go into emergency rooms at 11 o'clock at night because they don't have any other option for their children who are suffering. Those are the people who will be
on the other hand,
disproportionately hurt, won't they?
Those, if she's not working, presumably she may still qualify for Medicaid. It's income-based, number one. Number two, children would still be covered under CHIP and other programs. And number three, what I tried to say earlier is that the cuts to Medicaid that people keep talking about don't occur till 2025. Not all, but a major portion of it, when the inflator rate goes down. We have 8 years. If the Medicaid inflation rate is still high, we can increase that in the out years. By the way, I've not seen the final bill, have not committed to voting for it, but I do think it's important to kind of clear up misconceptions.
Senator, how much is the whole Russia investigation and the president's preoccupation with Russia, the White House being distracted by that, how much is it getting in the way of business in the Senate?
Best as I can tell, not at all. I've had 3 town hall meetings, 2 last week, and then a telephone town hall last night, and not a single question came on Russia. It was all about health care, the economy, National Flood Insurance Program. We're Louisiana, we've had some problems with flooding. I was just struck listening to your program beforehand. In a telephone town hall and 2 town hall meetings, not a single question about Russia. I'm not sure that that's as much play in the Senate or at home as on TV programs. Are you concerned about Don Jr. and other members of the Trump campaign meeting with Russian lawyers claiming to be representatives of the Russian government or claiming to be part of a bigger plan for the Russian government to influence the presidential election? I think we have to all be concerned about Russian influence in our election, whichever form it took. But I have confidence that the various people investigating will come to the bottom of it. In the meantime, if we get distracted by something for which there's an ongoing investigation and don't tend to the issues at hand, Obamacare premiums skyrocketing, for example, or the economy, or jobs related to the economy, 1, we're not doing our job, and 2, we're being too easily distracted. We need to focus on the matter at hand. All right, Senator Bill Cassidy, we have to go. Wish we had more time. Thank you so much for being with us. We greatly appreciate it. Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.